Hello viewers, today's our topic is Treponema. Treponema is a most commonly known spirochete, and the most commonly known organism is Treponema pallidum. It is a gram-negative motile spirochete which has tapering, round or pointed ends. The size of the treponemas usually ranges from 10 micrometers in length and 1 to 1.2 micrometers in width. Generally, these treponemas can be stained by negative staining by using Indian ink and also Giemsa staining and silver impregnation methods. Coming to its internal structure, the cytoplasm of these treponemas is surrounded by trilaminar cytoplasmic membrane, which is also surrounded by a thick cell wall made up of peptidoglycan layer, and this peptidoglycan layer aids for rigidity and shape of the organism. Next, coming to its cultivation, the pathogenic forms of this spirochete are not grown on the artificial media, whereas non-pathogenic strains will be showing morphological and antigenic similarities with the Treponema pallidum. And the most commonly known strains will be Reiter strain and Nichols strain. Reiter strain is a most commonly found antigen in diagnosis of syphilis. Generally, when we want to diagnose syphilis in a patient, one will find for this Reiter strain. It usually exhibits an antigen which is commonly diagnosed. Generally, this Reiter strain can be grown in thioglycolate media which has serum. Next one is Nichols strain. It is first isolated from the brain of paralysis patient. Generally, the syphilis can be venereal syphilis and neural syphilis. In case of neural syphilis, the organism gets accumulated in the central cerebrospinal fluid, where it causes infections related to it. This Nichols strain is related to the neural syphilis, where it is isolated from the brain of paralysis patient, and it is mainly used for diagnosis and research purpose. And next, coming to this resistance. Coming to the resistance, this organism is delicate, readily inactivated by drying or heating. Generally, when exposed to the temperature of 41 degrees to 42 degrees for a period of 1 hour, this organism can be readily inactivated and killed in 0 to 4 degrees centigrade in 1 to 3 days. And in case of blood transfusion, when a patient is affected with syphilis infection, then in that case, the blood, when placed in a refrigerator for a period of 1 to 3 days, the organism cannot survive. So frozen blood for 1 to 3 days is effective in case of blood transfusions, where even if the blood is having these treponemal strains. Next, in order to preserve this organism viable for 10 to 15 years, 10% glycerol or liquid nitrogen at minus 130 degrees is more preferable. Coming to the growth characteristics, it is the Treponema is microaerophilic and requires only less amount of oxygen, and it in the sense can survive in 3 to 5% of oxygen contains. The Reiter strain, which we have already said, which is most common antigen used in the diagnosis of syphilis, will grow only on a defined medium containing a rich amount of vitamins, minerals, essential salts like albumin, etc. Next, coming to the antigenic structure. The group antigen is the writer strain, and the species specific antigen is polysaccharide in. And next one is the cardiolipin antigen. Actually, what is a cardiolipin antigen? The cardiolipin antigen is nothing but a hapten. It is a hapten molecule which is obtained from a beef heart. This cardiolipin antigen is nothing but a lipid hapten which is chemically known as diphosphatidylglycerol. And this cardiolipin antigen readily reacts with the reagent antibody, and the reaction of reagent with cardiolipin is termed as a standard non-specific test for syphilis. In many of the tests like Wassermann, VDRL, etc., the cardiolipin antigen test is most commonly and widely used because cardiolipin is an hapten obtained from the beef heart which readily reacts with the reagent antibody and indicates it is a positive. The reaction indicates positive test for syphilis. Actually, the disease caused by this Treponema pallidum is syphilis. Coming to syphilis. What is a syphilis? A syphilis is a disease which is obtained by sexual contact and caused by the organism Treponema pallidum. When the spirochete Treponema pallidum first enters into the body by many ways like through skin cuts or mucal layer cuts, etc. The first of all, the clinical manifestations will be occurred in mainly 3 stages. First, the primary stage, secondary and the tertiary stages. In the first primary stages, the first clinical manifestation that appears is the cankers. What is meant by a canker? Canker is nothing but an ulcerating lesion. Whenever the spirochete enters into the body at the site of infection, a canker is formed. Usually it occurs in the genital areas, rarely in the areas like mouths, nipples, etc. Generally, first the ulcerating lesion formed is usually painless, a vascular ulcerated lesion. And at this stage, the lesion is called a heart canker because it is painless and avascular, etc. And when coming to that, generally and then slowly a thick exudate rich in spirochetes is formed. The heart canker, now it will be consisting of thick exudate rich in spirochetes, and gradually before forming the canker, when spirochetes move into the lymph nodes will get swollen and non-tender. In normal individuals, the cankers may be a very few, but in case of HIV patients and immunodeficiency patients where they have very less immune system, a large number of genital cankers may be formed. The cankers are nothing but the ulcerating lesions which are consisting of more number of spirochetes in the cankers. Okay. Next, soon after the primary infection, it sets in all about 1 to 3 months of time period. Next, coming to the secondary syphilis. The secondary syphilis can be widespread by the multiplication of spirochetes in the body and also disseminates throughout the blood. What are the main characteristics that appears in the secondary syphilis are papular skin rashes. It forms a skin rashes all over the body and mucus patches at oropharynx. Oropharynx is the region at our pharynx, that is food pipe and also windpipe. At the region it forms a mucus patches and condylomata at mucocutaneous junctions. Whereas these secondary infections can undergo spontaneous healing, but in some patients like immunocompromised patients it may take up to 4 to 5 years. And coming to the when the secondary syphilis, sometimes after the infection they undergo into the quiescent stage, where it is known as latent syphilis. Means it becomes silent or inactive for some time. In that stage the syphilis is known as latent syphilis, where in such cases it can only diagnose it by serological tests, as we have discussed some serological tests like cardiolipin test, VDRL test, silver impregnation test, etc. These are the serological tests which are used for the diagnosis of syphilis. Coming to the territory syphilis, it mainly includes cardiovascular lesions, meningovascular manifestations, etc. Means in the territory syphilis the infection is getting severe and severe, okay, and has very few spirochetes in the body, and the body shows delayed type hypersensitivity in territory syphilis. And the next on the type of syphilis is congenital syphilis, where it is passed from mother to fetus, where mother is previously infected with syphilis, can when gave birth to vaginal canal, can pass this diseases, because when given during the time of parturition, when the birth is through vaginal canal, all and not only in Treponema pallidum, any disease regarding the sexually transmitted disease, any disease where mother is suffering from a sexually transmitted disease, can be obtained to the child by vaginal birth. Okay. Coming to the laboratory diagnosis, generally the syphilis can be of two types: neurosyphilis and venereal syphilis. In case of neurosyphilis, cerebrospinal fluid is obtained from the patient or an individual suffering from this disease and can be examined under the microscope. In case of the primary and secondary infections, the specimen from the superficial lesions is collected, a wet mount is prepared, and then to that a cover slip is added and observed under a microscope. And there are many other various tests like fluorescent antibody test, silver impregnation test, as I have told you, and can be observed by staining, Indian ink, Jimsa staining, etc. All these things can be observed in a dark field microscope. And fluorescent antibody test also, where either an antigen or antibody is coated with fluorescent dyes, and can be when the organism is present, agglutination forms which can be visualized under a fluorescent viewer. And VDRL is also a specific test for diagnosis of syphilis, which gives an accurate result. This is all about the infection caused by the Treponema pallidum, which is syphilis, a sexually transmitted disease which involves primary, secondary and tertiary infection, syphilis, congenital syphilis, which can be diagnosed by various laboratory methods, and also the most commonly used one is cardiolipin diagnostic method, which it is an antigen which readily forms reaction with reagent antibody. Thus, the positive results always indicates the presence of spirochete, Treponema, pallidum in a patient's sample. Okay, thank you friends.